Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Spigelian hernia and the hernia of the linea semilunaris. So before we move ahead, let's start with the diagrams. So assuming this is the umbilicus, there is the linea semilunaris. This is nothing but the linea semilunaris. And on the other hand, there is the transverse abdominis. Transverse abdominis. And then comes the Spigelian fascia. It widens, and this is the Spigelian fascia. And then comes on the medial aspect, there is the rectus abdominis. Then there is the posterior wall of the rectus sheath. This is the posterior wall of the rectus sheath. Then below there is the arcuate line. And as it tapers down, it is a transversalis fascia. So this is the transversalis fascia. Now there is a Spigelian belt, something known as a Spigelian belt. So this will be about 6 centimeters, and now we'll look into the theory. So what are the most common site of the Spigelian hernia? So the most common site of the Spigelian hernia is through the Spigelian fascia. So it is a Spigelian fascia. Next is near the edge of the rectus sheath. Edge of rectus sheath. Next is near the edge below the umbilicus. As well as above the arcuate line. Now let's look at another diagram. So we have the subcutaneous fat. So this is, we are calling it the subcutaneous fat. Next we have the muscle layers. And there is presence of the external oblique aponeurosis. This is nothing but the external oblique aponeurosis. Then comes the presence of the extraperitoneal fat. This will be the presence of the extraperitoneal fat. And these two will form the, so this is the parietal peritoneum. So these two they form the contents of the sac. So they are nothing but the contents of the sac. And superiorly, as we know, this is the skin. Now let's move further to the theory. So this occurs to the Spigelian fascia. The Spigelian fascia. So the Spigelian fascia is nothing but an aponeurosis of the transverse abdominalis. So it is a aponeurosis and it is of the transverse abdominis. Next is this aponeurosis layer is between the rectus abdominis medially and the semilunar line laterally. So this is between the rectus muscle. So it is between the rectus muscle medially. So medially it is the rectus muscle and semilunar is present laterally. So this can occur above or at the arcuate line. So it's at or above the arcuate line. And often it is interparietal. Often it is interparietal. So interparietal meaning with the hernial sac dissecting posterior to the external oblique aponeurosis. So interparietal with the hernial sac. So this is the hernial sac which is dissecting posterior. So it dissects posterior to the external oblique muscle aponeurosis. So in terms of the subumbilical region, and is due to the defect in the internal oblique. Next is in subumbilical region. And it is due to the defect in the internal oblique. So this can be the defect in the internal oblique. So what are the clinical features here? Clinical features, it often presents with localized pain in the area. So there is a localized pain which is seen in the area, and there is without a bulge. It is without. So there is localized pain and this is without a bulge because the hernia lies beneath the intact external oblique aponeurosis. So because the hernia, it lies beneath, this is present beneath. And beneath what? Beneath the intact external oblique aponeurosis. Intact external oblique aponeurosis. So how do you diagnose this condition? Diagnosis is by the ultrasound or the CT abdomen. So how do you treat this? Treatment is via surgery. To learn and grow daily like this, please do subscribe.